Hello everyone! So today Marie, Rosanna, Sherazad, Ophelia and I, we will present you 4 scenario cases analysis about medical device industry and more specifically medical devices aimed at type 2 diabetes. On this slide, you can see the matrix with our 4 scenarios. So we chose socioeconomical and technological macro elements to compose our matrix. To go in depth, we assume on one hand that technology will stay the same and healthcare provider will continue to use chemical compounds and devices that are already in the market. On the other hand, we assume that digital technology will expand more and more through the years and will thrive and even surpass traditional and chemical compounds. On the other hand, we choose socioeconomical factors and we only decided to focus about the reimbursement or not of treatment and medical devices by health insurance. It has a great impact on the choice of treatment for both healthcare providers and patients.
I will present you the first scenario that we imagine, which is the one where diabetes treatment use traditional technologies and are full reimbursed. We name this scenario the business as usual. For the first scenario, the impact on industry is neutral because patients don't have to worry about cost. However, it takes time for physicians to take charge of patients since they need to physically see patients, especially for type 2 diabetes, which is a chronic and very prevalent disease. Also, patients need to visit regularly their physicians, so there is a loss of added value and it increases the cost. The impact on patients' health is also neutral because patients can afford medical devices at home, which allows to have a good monitoring of their diabetes. However, with the traditional devices, they need help to be able to use them. For instance, they often require a trained personnel or family member. For this business as usual scenario, threats are the awareness about disease and the popular tendency to pay attention to what we eat, to eat healthy and practice sports. At the opposite, opportunities is that there is no new disruptive chemical compounds to treat diabetes, and for now, medical devices are fully reimbursed, so many people can access to it. About the strategy and action to take if that scenario happened, companies should become a leader in diabetes area and stand out from competitors. Also, to supervise this scenario, some KPI related to sales have to be measured. The market share should be loan monitoring and companies should focus on good marketing strategies to raise brand recognition. Regarding the transactional environments, the non-government organization can take actions to raise awareness about diabetes. The competitors are numerous and it exists a huge international commerce. And finally, contextual environments, the legislation will have a real impact on our strategy and social value as well.
In terms of scenario 2, the win-win situation, digital technology with full reimbursement. The impact on the industry is positive. Patients do not have to worry about costs. There is a high value added as it saves time for both patients and physician, and there will be an increase in sales. The government and insurance company can negotiate prices, but only to a certain extent. With respect to patients' health, it is positive. As diabetes is better monitored and managed, the device is very precise and easy to use, and patient can feel autonomous as it can be independent diabetic management. With respect to threats, the competitors, patents, competitive intelligence, or other medical device companies can play a role in lobbying for their own reimbursements and the new regulations of digital technologies. With respect to opportunities, medical devices being reimbursed can lead to more access. Physicians and patients are attracted to novelty, and they can gain new market share because of digitalization, especially for those patients who doesn't like the traditional products. And we have the easy FDA approval, the 510(k) approval. If the scenario were to happen, the strategic actions to be taken were to be to develop patient appeals due to big market communication campaigns, clinical trials which shows the efficacy to patients and physicians, and make sure that they are aware of the new technology. In order to supervise or orient the strategy, we will measure the market penetration, measure the healthcare provider adaptation to the new technology, and patients' perception and satisfaction. In terms of the transactional environment, we can look at the customer's trend. There will be an increase in the number of diabetic patients. We can look at whether or not the shareholders, investors are happy, and the early adopter patients. And finally, in the contextual environment, there will be cutting-edge technology and new regulation systems in force.
The scenario 3 now, the nightmare situation. Traditional technology and no reimbursement situation. The impact on the industry is negative, as diabetes medical devices are necessary to monitor and control diabetes, so patients have limited options to choose from. Devices are not covered, so we would have a decrease on sales number. Traditional technology, so we have time consuming and we don't have any value added. The impact on patients' health is negative as well, as affordability refills can be a burden for patients who can't afford it. So poor management and monitoring and an increased number of diabetes cases. So we could have as a result life-threatening and poor quality of life. The threats, not attractive neither to patients or HCP. The opportunities, grow market share by becoming the stock for diabetes indication. The strategy and action to take if the scenario happened. We have lobbying and strong force for sales. What do you have to do to supervise this scenario? Measure market share, and survey to measure if we are adopted as a stock. The transactional environment, strong competition, lobby with regulators and government. The contextual environment, prices can be an obstacle, so patients might buy cheaper MD and MD abroad.
I will introduce the scenario 4. The scenario 4 is the case in which we have a digital technology but no reimbursement. The impact in the industry is negative. Indeed, with this scenario, there will be a competition in pricing and we will face price constraints to meet stakeholders' demand. Regarding the impact on patient health, it will be neutral. The digital technology affords better monitoring and management of the disease. The device is multifunctional and durable. It allows also better precision and adaptability. Unfortunately, with this solution, this will not be affordable for patients as there is no reimbursement, and they will seek another alternative which might be cheaper but less effective. Plus, fully digital technology will probably require upgrades, which can be out of the pocket expense for the patient too. There are different threats and opportunities for each scenario. Let's analyze deeper for this scenario 4. Threats will be hacking, GDPR laws, General Data Protection Regulation. Another threat is that less patients will be interested in the product because of the non-reimbursement. We can also assume that new regulation of digital technology can appear. Let's talk about the opportunities now. New technology will be very attractive. In fact, the digital is the future. Digital technology will allow better patient care. With this scenario, we can make assumptions on the different actions to take. First, lobbying to obtain the reimbursement of the technology. Then, target physicians by sensitize them to this new technology. Another action could be to show them the efficacy of our technology thanks to clinical trials. And so, make our technology essential for diabetics. To supervise this scenario 4, we will make sure physicians are aware of new technology. Plus, we can make survey measuring the adoption of this new digital technology. Finally, transactional and contextual environment could be impacted in different ways for this scenario 4. For transactional environment, competitors are numerous. The number of investors can impact this scenario as well. We can also presume our product will be influenced by new legislation. Regarding the contextual environment, we have a cutting-edge technology. A new regulation system in force can have an impact too.